do you believe that that is going to have any impact on what you do?
I guess it depends on, when you say legalize medical marijuana, is that what you said?
Yes, medicinal marijuana.
There's both sides of the fence. I'm not in favor of legalizing marijuana, okay? But for medical reasons, I think I would support that. I know there's a lot of people that their children suffer from seizures, epilepsy. There's all kinds of illnesses that people are battling, fighting. I'm not in that situation, thank God. But if I was, and medical marijuana would help my child or my grandchild, or something, I mean, I think I'd be for that. But again, I'd like to know before all that. I'd like to see the studies come out and prove that that actually works. You know, like research. Like, I know California, or not California, Colorado, and places like that. I'd like to see before I made a steadfast decision on it. Where that's all at. Because I don't know enough about the medical marijuana part to say it's good or bad. I'm just going from a personal, heartfelt. If it would help my kid, I'd want medicinal marijuana. But I'm not sure that would help my kid with epilepsy or seizures or whatever else they're going through. So I want more research, I guess, for that.
I guess
but THC in general, just legalize marijuana, I'm not for that.
I guess the root of my question was, do you foresee this having any kind of negative impact on drug abuse activity and the things specifically that the drug and alcohol program does?
Well, what I do know about medical marijuana, the THC is not in it. And that's the part that would affect our office. If that was part of the equation, yeah, I could see our numbers going up and more people using drugs, more people getting addicted and what have you. But from what I know about it, the THC, the part that gets you high, is not involved in that. It's limited.
Back to the heroin use. The other barometer was the statistics at the hospitals, the number of people that are going in there. So maybe they're not dying, but they are presenting. How have you tracked those numbers?
We continue to track that on a monthly basis. I can tell you, prior last year, like in October, November, December, the numbers were between 60 and 70 people a month. January, February, I didn't get March yet because we're not done, but January and February, they were in the 40s. So those numbers are going down.
Is that Good Sam only?
That's the only one I track. That's the only one in Lebanon County, so that's the only one I track. But the thing with the hospital, and I'm trying to do this, is build a relationship with the hospital. Dr. Yoakum calls me, I know someone died. But making a link between the hospital and our office, if someone goes in there, if they have 40 overdoses this month, I will not hear about it. Unless one of those people that overdosed calls our office. Because the hospital gives them all our information, but these people do not follow up with our office. So I'd like to make our relationship with the hospital better, so we're being notified of those overdoses and we're intervening with those people. And actually that's going to come down from DDAP. That's another, the pilot program that we started with the jail, that was forced upon us by DDAP. DDAP is coming down with more initiatives telling us what we need to do to continue to get their money. And one of the things is bridging the gap between our office and the hospital.
Okay. Really quick, just for clarification. So that 60 number and that 40 number, those are people that went there and then to you?
No.
No.
Those are people we rarely see.
Just presented at the
Oh,
hospital.
okay.
They present at the hospital.
All right.
At the
For
ER.
either a drug or alcohol situation. I get a monthly report from the hospital, no names, no nothing, just general.
Okay.
So I know people with drug and alcohol problems are presenting there,
Not good.
and I'm assuming after they present there, they're discharged. The other part of it is we contract, our office contracts with crisis intervention. So when those situations are going on, crisis intervention should be seeing those people as well. You know, I kind of look at crisis intervention as our in-between person, but it doesn't always work that way.
We'll keep working at it. We appreciate that.
So.